Good evening, I'm Natalie and this is UTS Advanced Eyewitness News. Today's top stories: our most widely prescribed drugs since their introduction from the 1980s. How well do they work? Are they really useful for us? And what effects do they cause? We are joined live with Dr. Hass. Good evening, Dr. Hass. Thank you for joining us.
Good evening, Natalie. Thanks for having me.
These drugs that everyone's talking about, ACE inhibitors, could you give us more of an insight about them?
Sure, Natalie. ACE inhibitors or angiotensin converting enzyme inhibitors are drugs used primarily for controlling hypertension and congestive heart failure in order to prevent strokes and to additionally prevent any kidney damage secondary to hypertension and diabetes. Many scientific studies have proved that individuals who are treated with ACE inhibitors do live longer lives than patients who do not administer the drug. The first manufactured ACE inhibitor was captopril, but more common examples used among individuals worldwide nowadays are lisinopril and ramipril.
Many people are interested to know, how do they work?
These drugs competitively inhibit the activity of ACE to prevent the formation of the active octapeptide angiotensin II from the inactive decapeptide angiotensin I. This occurs in blood and tissues such as the kidney, heart, blood vessels, adrenal glands, and the brain. Angiotensin II is a vasoconstrictor that promotes aldosterone release, facilitates sympathetic activity, and has other potentially harmful effects on the cardiovascular system. Reduction in blood pressure secondary to vasodilation following ACE inhibition is greatest when the renin-angiotensin system is stimulated, for example, following diuretic therapy or in people who suffer from renal artery stenosis. But ACE inhibitors additionally lower blood pressure when there is normal or low activity of the renin-angiotensin system. Inhibition of ACE leads to the accumulation of kinins, including bradykinin, which promotes vasodilator activity and may contribute to the overall effectiveness of ACE inhibitors. So in summary, this group of drugs cause relaxation of blood vessels as well as decreased blood volume, which leads to lower blood pressure and decreased oxygen demand from the heart. They inhibit the angiotensin converting enzyme, which is an important component of the renin-angiotensin aldosterone system.
Wow, this sounds great. Many women that may not be aware about these drugs would like to know if they would have any effects during pregnancy.
That's right. A lot of people are not aware that these are prescribed drugs, not recommended for pregnancy. So if your doctor is prescribing you this during pregnancy, then we have an issue on our hands. But with all seriousness, these can be potentially harmful as it can cause fetal toxicity.
We don't want that happening. Also, Dr. Hass, people of Australia want to know if there are risks in taking these, or would they simply benefit us?
Well, yes, of course. For everything comes advantages and disadvantages. For instance, ACE inhibitors have revealed to increase nitric oxide concentration in addition to increasing bradykinin levels that leads to improvement in endothelial function. But let's talk about the clinical levels, the benefits. The benefits are basically that if you look across the cardiovascular spectrum, if you look at diseases such as coronary artery disease, congestive heart failure, stroke, and renal dysfunction, across the vascular spectrum of risk, ACE inhibitors have been shown to reduce all-cause mortality, reduce hospitalization rate, and improve the quality of life and symptoms for the patients. So benefits are many. However, these drugs are not without their side effects. The side effects could be grouped into those that are related actually to higher bradykinin levels, which is cough and angioedema. Angioedema is rare, but cough is present in approximately 20 to 25% of patients, and in those particular patients, an angiotensin receptor blocker may be fairly beneficial, where the cough is relatively much less. The additional side effect as a result of decreased blood pressure will cause the patient to feel dizzy and may have difficulty in breathing. ACE inhibitors also may interact with other medicines such as non-steroidal anti-inflammatory drugs, antacids, potassium supplements, certain diuretics, and lithium. A major concern among people is the deteriorating renal function. Now we have to remember that ACE inhibitors related to worsening renal function is primarily a function of renal physiology, and it does not necessarily represent a poor kidney function per se. If patients do not suffer from the renal artery stenosis and are not dehydrated, a little increase in creatine does not mean they need to cut back on the ACE inhibitor dosage or stop these medications altogether, because in the long run these are really beneficial, and most of the time this should not be a valid reason to stop ACE inhibitors therapy.
This all sounds very interesting. I hope many people are more aware about these drugs. Well, Dr. Hass, it's been a pleasure having you.
Thanks for having me.
Stay tuned for the Late Night News with Mark Roberts. I'm Natalie Claire, and this is UTS Advanced Eyewitness News.